Hello to everybody. I'm Dr. Sotiris Chimas from Greece. I'm hair transplant surgeon at Athens, Greece.
Hello doctors, I'm Dr. Vivek, co-founder ISHR Hair Transplant Training, and meet our new president at Athens, Greece, the famous hair transplant surgeon Dr. Sotiris, who will be conducting workshops of ISHR in Europe at Athens and Greece. So now ISHR comes to Greece and full Europe with very advanced biotech instant direct pen FUE techniques. We'll be training a lot of doctors, surgical assistants, so that Greece and the Europe have highly qualified, highly experienced with the latest techniques, new budding doctors for hair transplant and newer technicians certified by ISHR at Europe. ISHR is coming as ISHR FU Europe at headquartered at Athens and Greece. So dear doctors, hair transplant is all about hand-eye coordination under magnification. You need a lot of hands-on, a lot of practice both on the dummy and under supervision on the real patients to be able to excel on the skill. So we are around 15-year-old organization and we have attended top forums of the world. We are in touch with the best doctors in the world. We have our own experience. So at ISHR FU Europe workshops, which will be conducted for doctors and surgical assistants, we will pass on all this knowledge to you. We will also help you from A to Z to set up your clinic, to get your trained technicians and trained doctors initially if you're not fully confident. And as you know, in the whole Europe, surgical assistants are in demand. They are very less, they need proper training. So every doctor needs 2-3 surgical assistants. So keeping this in mind, we need to develop a lot of surgical assistants too. We will also discuss about legality of practicing in different countries, what should be your qualifications, what can a surgical assistant do, what can a doctor do, what sort of setup you should do with emergency facility, where you should source the right equipments. So our technique, the latest 2023 technique which will be taught in these workshops is called Biotic Instant Direct Pen FUE. So what do we mean by Biotic? Biotic means utilizing regenerative products so that you don't have a post-FUE white dots or microscarring or reduced. Using biotech products for a better hair survival after the transplant. What is instant FUE? Instant FUE is latest 2023. That means taking out the grafts and implanting it simultaneously, reducing the out-of-body time of the hair grafts. Traditionally, they are kept for 3, 4, 5, 6 hours outside. They may also grow, but chances of these grafts simultaneously being transplanted to a recipient, the growth should be better. As you know, as the grafts are out, it's like a fish, it's crying for oxygen. They go into anaerobic cycle, lactic acidosis, free radical injury, sodium potassium pumps are gone. So we are doing a lot of research on cellular aspect of FUE because after hair being transplanted, a lot of work still has to be done so that its survival is taken care of. We're going to discuss the angles, 20-25 degree in the forehead and the frontal scalp, 30 degree or so at the mid scalp, 45 degree or so at the crown, temples 5 degree, frontotemporal angle 15 degree. How do we decide the depth of the hair slits we make, the width of the slip, the directions, the curls. So designing aspects of the hair transplant. Normally you will have more grafts to implant if the person is Norwood 6 or 7 and you have less grafts with you. So how do you plan and distribute graft in such a way that even if less grafts gives a better illusion of density? How do you design a hairline? It's called designer hair transplant. What is his height? What is his skin age? Does he have a round face, square face, triangle face, long face? Accordingly as per his age and other characters. This is known as science of anthropometry. We have to design the hairlines. We have to use soft hair from the front. We have to use singles after that. So they should be phasing like a feathery hairline. It should be zigzag like a seashore hairline. And which side of punches are good? What makes a great hair transplant? Step 1, 2, 3, 4, 5, 6. So we'll give you a 50-point protocol from 1 to 50. What makes a great hair transplant and what are the common mistakes 1 to 25, which is done most commonly. So you have to go through our clinic, see the patients, follow up patients, how we draw the hairline, how we consult, how we do the surgery. So it's not just about a PowerPoint presentation and touching 1 or 2 patients. It is about whole experience of few days sitting with us, watching patients coming and going, follow-ups, complications, results. As you are in the clinic, the old patients will come up with the results. So hand-eye coordination under magnification, trained by us under supervision of an expert, is the right thing, and with whom you can hold your hand for 1 year. So our faculty you can access for 1 year. Whenever you're doing your own cases for 100, 200, 300 grafts, you should send your investigations, the hairline designs and the procedures, photographs to our faculty, and talk to them before you start your 100, 200, 300 grafts hair transplant. So 1 year faculty support is very important. Then comes your branding, marketing, positioning. There's so many clinics out there. How do you differentiate? How do you be better than them? How do you get noticed? So this is an A to Z solution for setting up your hair transplant center. So if you have any comments, please write down and contact us at the below number to get more info regarding eligibility, regarding the dates available. We are into one-on-one workshops, not too many doctors at a time, so that we can give you personalized attention. Thank you so much, doctors. Looking forward to help you start your hair transplant division.